All right, good afternoon, everyone. We are ready on our side, so we'll give the media houses 30 seconds to do their station IDs and come over. It's now 6:15. We're ready. Good evening, everyone, and welcome to the Media Center here at the Office of the Prime Minister in Kingston, Jamaica. Prime Minister, the Most Honorable Andrew Holness, presided over the meeting of Cabinet today concerning issues relating to COVID-19, among others. The Prime Minister, as is his commitment to update the nation, is now here, and he is ready to give the formal briefing. With the Prime Minister this evening are Ministers of Cabinet, Dr. Nigel Clark, the Minister of Finance and the Public Service, Dr. Christopher Tufton, the Minister of Health and Wellness, the Honourable Carl Samuda, Minister of Education, Youth and Information, the Honourable Desmond McKenzie, the Minister of Local Government and Community Development, the Honourable Senator, the Honourable Kamina Johnson-Smith, the Minister of Foreign Affairs and Foreign Trade, along with the Attorney General, Mrs. Marlene Malahoo Fort, the Permanent Secretary here at the Office of the Prime Minister, Audrey Sewell, Mr. Dunstan Bryan, the Permanent Secretary in the Ministry of Health and Wellness, and the Chief Medical Officer, Dr. Jacqueline Besacer McKenzie. The Prime Minister is ready. Mr. Prime Minister, good evening.
Thank you very much, Naomi. Good evening, Jamaica, and to our Jamaicans listening in the diaspora, and a special good evening to those Jamaicans who may be on the high seas, on cruise ships and other vessels right around the world who may be listening to this live stream. It has now been 70 days since our first case of COVID-19 on March 10, 2020. I am very pleased to report that we have had no new confirmed case in the last 24 hours. And I'm also happy to report that four more persons were recorded as being recovered and released. This means that we now have 520 confirmed cases with 131 recoveries, and unfortunately, 9 Jamaicans died with the disease. Therefore, there are currently 380 active cases. The graph, which will be displayed shortly, shows that our first 100 cases, we were briefly on the 6-day doubling curve and then moved to the 8-day doubling curve, then to the 10-day doubling curve, and to the 12-day doubling curve, and now we are approaching the 15-day doubling curve. So just for our viewers watching, the colored lines represent the various doubling curves, meaning the time it would take to double from wherever on the curve you select. So from our first 100 case, that's when we start measuring our doubling. And you would see that the dotted line represents the cumulative cases excluding the workplace cluster, and the solid line represents the cumulative cases with the workplace cluster. So currently, our cumulative cases are 520. And you would see that for a few days we were on the 6-day doubling curve. That means the solid black line was running very closely to that red line. Then we crossed over to the 8-day doubling curve, and then we crossed over to the 10-day, to the 12-day, and now we are heading towards a 15-day doubling. Of course, the longer it takes to double, the better it is for the country, and it shows that there are less new cases being confirmed each day, and basically you would then say that your curve is flattening. And that's the objective. That's what we want to achieve, a flattening of the curve. Now, from the 21st of April, the government of Jamaica wrote to the Royal Caribbean Cruise Line expressing our willingness to explore the possibilities for the repatriation of Jamaican ship workers. Since then, we have been exchanging communications about how and when this repatriation would be done. Twice in Parliament, I was asked about preparations for cruise ships. On both occasions, I explained that preparations were being made and that these were resource-intense activities, meaning that they require significant resources and logistics. I also explained that the details of the preparations were not yet finalized, and therefore we could not discuss them in public, because that is the good faith nature of how we undertake these discussions. And it's important for the public to understand that when you're negotiating these arrangements, things will change. The ships may say, we're coming in on X day. And then something happens and it is a different day that they may actually decide to come. They may tell you that we have X number of passengers, but something happens and it's a different number. So there are always moving targets, moving objectives, and until they are finalized, you expose yourself by saying anything about the agreements prematurely. Because we could have rushed to the public to try and quell any mischief by saying, yes, we have an agreement to bring back X number of workers on X day, and then something happens, and that changes. So, as a rule, we have decided as a government, as I've said in Parliament on both occasions that I've been asked, that we do not discuss these arrangements until they are perfected. It's a risk to the government because opportunistic persons may want to occupy that void of information with false information, trying to seek relevance even, and mislead the public. What that does, deliberately or otherwise, is to distract the attention of the cabinet to go into deliberations as to whether we should say what we are doing or allow the agreements to settle before we speak. In that void of information, all kinds of mischief can be created. And it is important that I say this to the public of Jamaica. Be careful how you are led astray by those seeking relevance, by those seeking to exploit a crisis for reasons that may not be in your best interest. So it is important that the public notes that from the 21st of April, the government of Jamaica wrote to our partners in the cruise ship industry that we have had long-standing relationships with, the Royal Caribbean Cruise Line, expressing our willingness to explore possibilities for repatriation. We didn't need anybody to tell the government of Jamaica that we should explore those possibilities. We wrote. So those who are trying to claim paternity and somehow to become the defenders of people's rights, we weren't bragging to the people about that. We were doing our job as the government. It's important that I say it in this way. I've avoided any sort of political nuance, but it is clear that there are those who are seeking to exploit crisis for political gains. And I urge the people of Jamaica, do not be distracted by them, as your government in your service will not be distracted. On Friday last, RCCL requested a conference call to make final arrangements. This morning, I had a conversation with the President and CEO, Mr. Michael Bailey, and his team, and it was very productive. Despite postings in social media and attempts by third parties to mislead and confuse, the negotiations between RCCL and the Jamaican government continued in a positive way and has yielded positive results. Today, Cabinet approved specific protocols related to the re-entry of this particular ship, the Anthem of the Seas, which will repatriate the largest number of Jamaicans at any one time to date. We have now given approval for the Royal Caribbean cruise ship to arrive in Falmouth at noon tomorrow. This has been conveyed to our partners, Royal Caribbean Cruise Ships, and to the Port Authority. They will follow through the necessary maritime regulations to ensure the safe docking of the ship in Falmouth. The Ministry of Health and Wellness will create a sterile zone around the port to conduct testing. The cruise ship workers will be disembarked in groups of 200 every 48 to 72 hours, and after testing will be taken to the Grand Bahia Principe, where they will be accommodated. They will each, as I said, be tested, and the 48 to 72 hour period is to allow time for results to be available. We have secured 400 additional rooms at the Bahia Principe to facilitate this phased disembarkation. And again, I want to thank the owners and operators of the Bahia Principe Hotel. They have been very good to the government of Jamaica, and I personally want to thank them for making their facilities available. It is a sign of good corporate citizenship. Persons whose tests are positive will be moved into a state quarantine facility until they recover. All others will be allowed to go home and self-quarantine for a further period to 14 days from the date of disembarkation. The home quarantine period will end 14 days after they disembark the vessel, providing, of course, that they test negative, which is a positive thing. Persons allowed to quarantine at home will need to consent to have their locations geofenced using smart technology through the Jam COVID-19 app, and to do a video check-in multiple times a day while in quarantine. In addition to the Royal Caribbean workers, we have nearly 900 additional Jamaican cruise ship workers who we are working hard to get back home as soon as possible. And there are other Jamaican seafarers on other vessels around the world who may be seeking to come back home. It is important for the public to appreciate that this situation and the challenges that it brings are not unique to Jamaica. There are over 100,000 ship workers from around the world that are still on ships trying to get back to their home countries. It is a situation that I deeply empathize with. I get the voice notes as well, and I can well understand the frustration that the ship workers are facing, being in quarantine for almost 2 months, eager to see their families. They can't move about freely. We well understand. But Jamaica is a country of rules. Rules don't mean that you can't have sympathy and empathy and you can't act expeditiously to ensure that suffering is minimized. And that is what we do. We do that whilst maintaining the rules and the order. Once you break down order, your ability to actually assist persons who are suffering diminishes, despite your good intentions. And we have learned a tough lesson as a government. We took note of all the hardship cases right across the globe, over 60 countries, and we were doing our best, stretching our limit to bring in our Jamaicans who were stuck in countries that they could not call their home. But in bringing them back, we were not able to give them, at first instance, the experience, the good experience that they deserve. Primarily because, as I said earlier, these are resource-intense activities. We cannot afford that to happen again. So we have to make sure that we perfect the arrangements, that we move quickly as well and put the resources in place. Whilst at the same time, I can assure you that the Ministry of Health, the Jamaica Defense Force, the Ministry of National Security, the JUTC, the PICA, all the agencies involved in this rendition of bringing back our Jamaicans home safely and securely. We are working to expand our resource base so we can get this done in short order. We now have over 9,000 applications on the Jam COVID-19 platform from Jamaicans who wish to return home. We are in the advanced stages of developing a home quarantine monitoring solution that involves the use of monitoring devices and this will be integrated into the Jam COVID-19 mobile app. I want to spend a little bit of time on this. We will never be able to accommodate 9,000 Jamaicans who have applied on the app seeking to return, whilst there is still a requirement for quarantining Jamaicans or others who come into the island. Jamaica is not the only country that is requiring a period of quarantine for persons entering the country. In fact, large countries like China requires that. The truth is that in terms of a public health assessment, the risk of a spike is still a significant risk. And we have seen in other countries, like Singapore, for example, where when re-entry is not controlled, it can add significantly to our numbers. So we are still in the phase of the epidemic where quarantine for persons re-entering is required. We can't house, as I've said, all the persons who will come in during this period, and therefore home quarantining will be a modality which we will have to pursue. To effectively pursue that, we have to ensure that when we allow persons to go home, that we are not just depending on their faithfulness to the quarantine rules, that we are able to, in some sense, guarantee that if they are asked to stay home, that they are actually staying home. In another week, the next time I am addressing this press conference, we will be able to give further details as to exactly how a standardized home quarantine system will work with the use of monitoring technology. We are now in the process of procuring such technologies. We have decided upon it. We identified the supplier. We have done some analytic work on it, and we are now moving to procure. As you will realize, these are not equipment that I can order online or go to the nearest technology shop. They, in most cases, have to be manufactured or at least assembled. I'll now turn to the St. Mary quarantine. The communities of Dover, Enfield, and Another Bay were placed under quarantine on May 7th for 2 weeks. During the period, contact tracing was enhanced, and in total, 130 samples were collected from contacts. 2 were positive, bringing the total positives in the quarantine areas to 16. All confirmed persons are close contacts or are related, all confirmed persons and close contacts are isolated within state facilities. You can see why I would have been a little bit confused. Fever and respiratory surveillance were conducted in these communities over the period at least twice, with over 2,000 households visits and over 7,000 assessments done. Persons with symptoms were tested, and these results are so far negative. A total of 118 samples were collected. A batch of 82 samples was collected yesterday, and we await those results. Essentially, the quarantine and surveillance of the community has yielded a further 2 positive tests. Based on these outcomes, the quarantine will be lifted at the end of the 2-week period. Community surveillance will continue in the affected communities, and influenza-like illnesses and severe acute respiratory infections surveillance will continue in all the health facilities. So let me take this opportunity. I've been following the quarantine communities in St. Mary. Started out a little rocky, as all the communities would, because of the need to act immediately. So having acted, you would not have all resources in place. But I believe that the members of Parliament and the Ministry of Labour and Social Security and the Ministry of Local Government acted, in my opinion, they did a great job, along with the Ministry of Health, to provide the essential services to the residents. And I think, by and large, the residents appreciated the effort, and they themselves acted with responsibility. That is the report I have received from my contacts in those communities. And I'm very pleased because, in general, I think Jamaica is coming to the understanding that if there are clusters, the government will have to act to contain them, and a part of that action may be a quarantine. So I think the people of Jamaica are understanding that this will be a standard action in the future. A part of our orders is the work from home order. The current work from home orders will expire at the end of May. We intend to allow persons other than our vulnerable population, that is persons aged 65 and over or persons with comorbidities, we intend to allow all other persons who are working persons to be allowed to return to work effective June 1. Of course, all the normal infection prevention and safety protocols would need to be in place. The various protocols for factories, workplaces, banking halls, etc., are being developed in conjunction with the private sector organization of Jamaica. So let me just quickly summarize this position. From a public health standpoint, in terms of where we are in the progression of this pandemic, we are now at the point where we can say to our Jamaican workforce that you should return to work. So we will lift the work from home orders. Well, not lift is not, we will allow it to expire. So they come to an end at the 31st of May. So I want you to consider this announcement as notice that this will be done. During this notice period, the PSOJ, working through the Economic Recovery Committee, will, in collaboration with the government, will finalize what the new workplace protocols should look like. And this will give time for those protocols to be put in place. This is a further signal that the government is encouraging the smart return to full productive capacity. This is a further signal that Jamaica has to learn to live with COVID-19. So we see many calls, open the economy, all kinds of calls, give a date. We are working assiduously to make sure that every move that we make is in the best interest of the Jamaican people, that we will come out of this epidemic as a stronger nation. Yes, I am certain that what we have done will ensure that we conquer the public health epidemic. We are now turning our attention and focus to ensuring that we conquer the economic recession that could come as a result of the public health epidemic. And so we have to move with speed and alacrity in getting people back to work, in giving signals as to when our borders will reopen and when certain major industries like tourism can restart. Because the truth is that our ability to be successful from a public health standpoint relies on our ability to keep our economy afloat. So with that presentation, ladies and gentlemen, I turn over to the Minister of Health, who will give his his update. He's saying that I've given the update for him. So if you want to say a few words, Chris, that's fine. If not, I will ask Minister Vaz to give an update on the BPOs. Minister Vaz was given specific responsibilities to ensure that the BPO sector gets back on track quickly. So Minister Vaz and then Minister Tufton.
Thank you very much, Prime Minister. Good afternoon, ladies and gentlemen, and viewers around Jamaica and the diaspora. So, 4 weeks ago, Prime Minister Holness asked me to chair a BPO task force on the heels of, obviously, the situation with an outbreak of COVID within the BPO industry. I am pleased to say that after 4 meetings of the task force, the last one being last week, Thursday, that the Ministry of Health presented for final approval a list of health protocols as it relates to the operations of the BPO sector. And that was considered and approved by the BPO task force, which includes members of the BPO Association. Just to give you a very quick outline, the following outlines the specific measures which must be implemented and adhered to in all facilities of this type: sanitary and hygiene practices, furnishings and equipment, social distancing and COVID-19 risk reduction measures, transportation, ventilation considerations, environmental cleaning and general consideration, handling of sick persons, measures to be taken where an employer is tested positive for COVID-19, public relations, communications, and mask etiquette. So the inspection procedures will be undertaken by the public health inspectors using the following instruments: BPO inspection tool. This has been specially prepared in relation to the COVID-19 pandemic. It seeks to ensure that all the conditions are put in place to minimize the risk of transmission of these entities. Public health institutional health inspection form. This is a tool used to assess the general public health conditions existing in the facility. Upon completion of the inspections, a report is prepared and given to the proprietor within 36 hours. Where breaches are identified, a work plan is also prepared with specific timelines for abatement. So far, out of 91 BPOs, we have inspected 89. The number of satisfactory so far is 57, but that figure is somewhat misleading because a number of them are in the Kingston and St. Andrew area, and there were some issues in relation to that. So by speaking tonight, I would have expected that quite a bit more would have been done. More specific, Prime Minister, in terms of the workforce within the BPO sector. So we have 13,000 working from home, while we have 9,000 essential that were exempted. So that would be 22,000 out of 40,000, a workforce of 40,000. 7,448 were temporarily laid off because of the COVID crisis. And I'm happy to say the latest figures, which are not up to date as of today, is 1,800 of those have come back on stream and have been started working. And I can say, Prime Minister, that there is, as we speak, based on the fact that the protocols were just agreed on Friday, a number of reconfiguring of several BPO outlets that are going to bring on more employment in the coming weeks because of, obviously, the necessary partitioning, the 6-foot social distancing. So there's a lot of reconfiguring. And there also is a lot of interest for new BPO space. So there is need for the latest order to be amended based on the protocols that were just agreed on Friday, which I have sent to the Attorney General. But So far, I can say with confidence that we are in a much better position, not because I'm the chairman of the task force, but because we are moving to make sure that we put the BPO sector back on the footing that they can continue to create the employment and the foreign exchange well needed in a time like this. Thank you.
Thank you, Minister Vaz. Good job, good job. Just quickly to add to what Minister Vaz has said, the BPO sector is one that the government intends to further promote because it is the industry which is offering the greatest potential to replace employment that would be lost as a result of fall off in other industries. Jamaica is a natural fit for business process and knowledge process and global services operations. And we will intensify our efforts in this regard, which will include improvements to our legal and regulatory framework and expanding our investment portfolio in the infrastructure to support the BPO industry. So I want to use this platform to signal to the industry that this is an area of intense effort by the government. Minister Tufton, if you will give your regularly good report.
Prime Minister, I won't be as regular as normal because I think you have given very adequately the overall substance of the current scenario, but I will just emphasize for a few minutes a couple of things. First of all, the numbers are suggesting, I think, that we are managing the process fairly well, and I want to again use the opportunity, of course, to thank not just the guidance of the Prime Minister and the Cabinet, but the frontline workers in the field, the nurses, the doctors, of course, the team at the Ministry of Health and Wellness, and in particular, as we move in the phase of discontinuing a quarantine area, St. Mary, the team on the ground in that region have done a really amazing job in tracking down, doing the interviews, doing the inspections, doing the contact tracing, and has, to my mind, allowed us to, as a country and as communities, to bring closure to that phase of close monitoring and supervision. I want to also mention the fact that we have for the second time, no confirmed case, and that again is an indication that we are able and have been able to manage through the respective parishes and communities using the team on the ground, and that Jamaicans, for the most part, are responding to the messaging, and that is a very positive development. You did not mention, Prime Minister, that with the no confirmed cases, we have had some cases that have recovered. We have moved now from 127 to 131, so we have released in the last 24 hours an additional 4 persons, and the rate of recovery now is 25.2%, so it's increasing over the last few weeks, and the number of persons who have died, 9 represents 1.7% of the overall number, which by international benchmark standards, though still regrettable, represents an indication, another indication that as a country we have done well, and it's everyone counts, all of society approach. So I mention it just to provide encouragement for all of us. The final point I wanted to raise is, as it relates, Prime Minister, to the 1st of June expiration of the work from home orders, and which means that persons are going to now be encouraged to go back to work, to their physical space where they would normally work. And from a public health perspective, there is a lot that will be done over the next few days, working with our respective stakeholders in the PSOJ, the Jamaica Manufacturers Association, the Jamaica Chamber of Commerce. That process has started. What it means is that we will work together with these respective associations to develop the protocols around those working environments, because, as the Prime Minister said, we are now embarking on a life living with COVID. So we're moving back to normality, but in a sense, it's a new norm. It requires some adjustments as it relates to personal hygiene and sanitation, as it relates to some of the measures that you have to take, not just in your home, but now in your other home, in your workspace. And so the protocols are really going to be establishing some benchmark practices within those environments. And it's a collaborative effort. But what it will mean in the weeks to come is that the health officers may have to do inspections. So they will have to visit these environments outside of the conversations that will take place and the new standards established, just as we did with the BPO. And I want to just signal to the country, to employers, to the umbrella bodies, to encourage their members, employers, to receive, to support, to give appropriate levels of coordination services to these individuals, these health officials, as they go into companies to help you to establish these standards. One of the things we cannot do is to get complacent, even though we are making progress. We do not want to fall back in a position where we may have to restrict movement in the future because we have not made the progress continue. So I just want to say that this new phase of living with COVID that we are now embarking on is going to require continued collaboration. And I want to use the opportunity to encourage all of Jamaica to support the health team wherever in Jamaica they are once they approach you to help you to overcome the challenges of COVID. Thank you.
I want to ask the Minister of Education to join us to explain the current position on the CXC examinations. He will be brief. Then we'll have the Minister of Finance to quickly come after, who will be brief, to give an update on the CARE program. And of course, we will have the Minister of Local Government to tell us in 1 minute or less what is happening with the reopening of bars.
Thank you very much, Prime Minister. I'd like to first start by welcoming our Permanent Secretary. She was here last time and I didn't see her and didn't recognize her. But she has been doing a fantastic job, leading a great team. I just want to cast this in a background, where we are talking in this whole exercise of the CXC of 74,900 students. That's the total involvement, involving some 7,500 teachers. Because of the difference in opinion between the CXC that met and decided that we would have the exams in July, early part of July, and our reservations about that, pending, of course, the decision by the Ministry of Health as to whether we were ready for it, coupled with our own view that the children had been set back because of the lack of the conventional classroom teaching exercise. We were not satisfied that simply to disagree would carry the whole process further or far enough. So I had a meeting with the principals and the team that, all the coordinators, 135 principals, and you know the people who coordinate the examinations, both public and private. And it involved 171 high schools. And during the course of the discussions, it was clear that the vast majority of those present in the meeting preferred us to go forward rather than to delay the exam. That will be a controversial issue for some time because there are those, and the views are strong on both sides, that we should delay it because of the setback that they experienced, and others who feel that we should proceed because in great part effort was made to get the children to a point where they could do a good job. what it has done, it has unearthed some weaknesses in the structure that now needs to be repaired as we go forward. One of the most important things is our lack of communication in the absence of the classroom setting. The internet service across this country is inadequate. The service offered in certain communities where children had to study on their own is inadequate. As it was shown, where only about 26% of the entire internet service was stable enough to facilitate proper classes, virtual classes. 51% totally unstable, and 23% was almost non-existent. Existing, but almost non-existent, and not certainly a tool that can be used going forward. In any event, because to extract information through the internet with the facilities that we have is totally inadequate, Prime Minister, and we have to do something about that very quickly. It showed that despite the great effort of the teachers, and they're a phenomenal bunch of people who devote all their lives to just seeing to the well-being of our children, and they deserve maximum commendation. But one thing is quite clear, is that we are going into these exams, and we are not entirely ready for the exams in certain schools. In other schools, very ready. But in some schools, not quite ready. Because the view of the ministry, Jamaica's position, we wanted a predictive grade through the use of the student-based assessment to determine an approximately or an appropriate grade for the students without having to write the exam. It is now decided that we will write the exam. We will have two through the internet and also the paper-based exams. So we will do our best to ensure that we facilitate our students in the best possible way, to give them the best chance to maximize their potential as they go forward. It's a very critical turning point in our educational system. This setback will only strengthen the process to make us more conscious of what has to be done and how quickly we have to get it done. In the process of all this, I spoke with Sir Hilary Beckles, who is the chairman of CXC. I also spoke to Dr. Wayne Wesley, who is the registrar of the CXC, and I also spoke with the principal, the registrar, the chairman of the CXC, of the COSAD, which is the overriding body which manages and sets these exams. In the process of doing that, I put the case to them that we just need a little more time, and they could appreciate that. And I'm very happy to say that they accommodated us, perhaps not in whole, but certainly in part. And so as a result of that, we will write the CXC on the 27th of July. Starting on the 27th, it takes about a couple of weeks into August to complete it. But the process will start on the 27th of July. And the question of social distance, it can be accommodated quite easily because all the other children are out of school, and it will be quite convenient. We will get through quite well. We will now go about the business of making the logistical arrangements so that no one who is taking this exam, beyond the challenges that they've already had, that they will in any way be compromised. And so I am very happy that we have finalized the arrangement, and I think perhaps when we look at it, it might be the best thing to get it behind us and move on to a new year, and I hope, Prime Minister, new horizons. Thank you.
Thank you, Minister Samuda. I'll invite Minister of Finance to give us an update on the CARE program. So the important news is that the government has decided that the CSEC exams will start on the 27th of July onwards. And I'm certain that though it will be a challenge, but we have gone through similar challenges before. I recall 2010 to be 1 year in which we had similar challenges, and we did sit the exams and we did quite well. So I have every confidence that our Jamaican students will do well, and I wish them all the best. Minister.
Thank you, Prime Minister. Just a quick update on the CARE program. The compassionate grant component of the program, which consisted of the most number of applications, has had a payout ratio, as far as the remittance companies are concerned, of about 80% so far. That is, of the persons who opted to receive their compassionate grant by way of remittance company, approximately 80% of them have collected those grants as at today. In fact, one of the larger payout companies, by choice of compassionate grant applicants, Western Union, would have reported on social media that they have over 90% of persons who selected Western Union as an outlet in Kingston and St. Andrew have collected their grants. And for that reason, the National Stadium and the National Arena, which has been used as a disbursement facility for those grants, was concluded, or that process was concluded on Saturday. By about 1 p.m. on Saturday, there was no one in the line. For the remaining 20%, the compassionate grants can be collected from the remittance company that you selected, and those remittance companies have indicated the branches that are available for such collection. We will be instituting a measure that allows, now that we have brought the numbers down and we only have about 20% left in the remittance category, we'll be instituting a measure that allows those who are having difficulty coming in to collect justifiably and objectively, for those to elect someone to collect on their behalf with the appropriate procedures, but more will be announced on that shortly. The CARE team will be turning its attention to the payout of the set cash grants, and I know that there is some eagerness and indeed some anxiety among persons who have been affected by loss of jobs, particularly in the tourism sector, and they want to receive their set cash payments. Let me just assure applicants that set cash grants are being processed, and we have about 26,000 in the pipeline, and I'm expecting that payments will be made to the commercial banks this week. Now, various commercial banks have various timelines between when they receive funds and when the funds are available in your account. For some banks, it's 1 day or 2 days, as the case may be. Now, we are in instituting the CARE program. We are trying to do things right by having a program that provides economic and social support at this time, but it's also important to do, well, let me reverse it. We're trying to do the right thing by having the CARE program in place that supports people socially and economically at this time, but it's also important to do things right. We're still a country of laws and rules, and therefore the CARE program, which is a multi-ministry, multi-department program, different agencies perform different functions. We have eGov that designed the system, and eGov accesses the tax administration database or the databases of other ministries, such as the Ministry of Local Government or TPDCO, as the case may be, and they have programs that perform the eligibility and the verification rules. Once they have done that, they pass the files to the Ministry of Finance, and the Ministry of Finance instructs the Auditor General to make the payment. Doing things right means inserting a procedure between the eGov and the Ministry of Finance, where we have invited the Auditor General to do a review of that algorithm for each set of payments. Now, that unfortunately introduces some delay in the overall process, but it is for the overall good. And, you know, we had that with respect to the compassionate grants, and we are also having it with respect to the set cash grants. And as I mentioned, I expect that the payments for at least 20-odd thousand of the set cash grants to be made to commercial banks on behalf of applicants this week. The processing of the best cash grants for the companies who have retained employees who earn less than $1.5 million a year, and we have about just under about 250 of those applications representing over 20,000 employees. Those will be processed or are being processed now, and we're having an independent review of that processing, and I expect payment to occur in May. And the same holds for the small business grants, which have also been processed, and that processing is being subjected to an independent review before payment can be authorized. That's update from now, Prime Minister. We have had some challenges with some persons who have selected bank accounts, because a lot of people selected bank accounts and had wrong branch, or in some cases they had the name on their account being different from the name of the application, and we've invited all of those applicants to re-enter that data, and once that's re-entered, at the next batch of transfers, that corrected information will be incorporated. Thank you, Prime Minister.
Thank you, Minister. The churches went back to their places of worship on Sabbath and on Sunday. I did my own checks, and by and large, I would say that the churches were faithful to the rules. They observed the orders, and more importantly, they self-regulated. So far, from as I can tell, and some churches opted not to go back as well. And I think that that is the appropriate approach to take, that we phase things in until we are certain where we are in the epidemic. May I invite the Minister of Local Government to give us an update on the reopening of the village retail bars.
Thank you, Prime Minister. As you all know, tomorrow, the 19th, the reopening of community bars and taverns will take place. I want to state clearly that the opening tomorrow only speaks to community bars and taverns. That means sport bars, nightclubs, and other establishments that sells alcohol will remain closed as the order stipulated previously. We did a sampling island-wide, Prime Minister, and based on the sampling that we did, points to 89% of the locations that were sampled are in high gear in making preparations for the reopening. We are expecting full compliance in some areas. I know that there are going to be challenges in some areas, especially the size of some of these bars. And some of the concerns that we are getting is about the seating arrangement, Prime Minister, outside of these bars, and these are something that we will take under consideration. I just want to make one point which is important, that we are not saying that all bars, taverns, and village bar must open. If you find it economically feasible and health-wise to do so, but if you can't at this moment, then you should remain closed. I am urging those who have not started the preparations, we will be taking all necessary steps to ensure that we get full compliance. We have provided some jobs, temporary jobs, to do the assessment right across the country, and we will have a field team of over 600 persons within the next couple of days roaming the island to ensure that we get compliance. Let me use this opportunity in welcoming those who have started the process and to encourage those who have not started to proceed. Thank you.
Thank you, Minister. I think we have covered significant ground. Questions are in order, if there are questions.
Thank you, Prime Minister. I must have you know, and for those who are watching, that ahead of the press conference, we do normally do tests with the media to ensure that we are technically sound. And so we use our Zoom platform, and we have a number of media practitioners on who would like to ask questions at this time. We ask again that you use the raise hand feature, and we will acknowledge you as soon as it is feasible to do so. Our first question, I believe, will come from Ms. Althea Saunders from the Jamaica Observer. Althea?
Good evening. Are you hearing me?
We're hearing you loud and clear. Go ahead, please.
All right. I have 3 questions. One is for the Education Minister. The other 2 is for the Prime Minister. Mr. Samuda, regarding the issue of CXCs, the JTA had raised some concerns about transportation for students. Is that something the government is contemplating, busing the kids to school? And for Prime Minister Holness, the lifting of the work from home program, does this also mean that the island-wide curfew will be discontinued? And in reference to the procurement of technology to monitor persons who are in home quarantine, can you say what the cost of this is and what kind of technology are we talking about?
Well, first of all, let me go to the last part first. Technology is, we are now in the process of building out in 100 of the 300 locations through Ready TV, internet connection and a provision for internet for those communities, not merely for the home where the student lives, but in the entire adjacent community. And that is the specific cost I don't have at hand. I can tell you what we pay him, but the overall cost is something that I would have to get for you at another time. The transportation is something that we have looked at, and we are prepared to subsidize the transportation for the students, especially those who are going to be coming in to write the exams. And going forward, we will look at the whole question of providing transportation for students who find it very difficult to traverse the areas from which they come, and who, without COVID, is very difficult for them. So we have to look at that, because we can't have our children lingering in the roads without adequate transportation to get them to the class as soon as possible. So that is something that the ministry will be looking at, to see the extent to which we can use the resources available to us to assist those children. The Minister of Finance is here, and he knows precisely, he's sitting there wondering if I'm going to mention appeal to the Ministry of Finance. I won't. We try to use our own resources, Minister. And you know our arrangement. Our arrangement is you're good to me and I'm good to you. I don't stress you. So we will definitely be looking at that to see how best we can facilitate the children so that they can get to school on time and home.
Thank you, Minister. Prime Minister?
Just very, very quickly, the orders that control movement, which would be the curfew orders, they have been very effective in the scheme of trying to control the spread of the disease. And it is not our intention to unnecessarily limit the movement of the population. So as soon as the opportunities present themselves, we have loosened the curfew hours. You will recall last week we announced that during the Labor Day weekend we will tighten for obvious reasons, because you may very well have persons seeking to engage in activities that might increase the transmission of the disease. So the short answer to your question is, even though we are saying to people, go back to work, the curfew orders will be appropriate to work hours, normal work hours. Remember that there are categories of essential workers that are exempt in the orders. So the curfew hours would allow for work in essential services within the curfew hours. So the short answer is no, we don't see it possible at this time in the epidemic to lift the curfew hours, but clearly we are making the adjustments so that you can get the maximum productive hours out of the day.
Thank you, Mr. Prime Minister. Next question, Zara Burton, 18
Sorry,
degrees.
before that, there was the question on the cost of the procurement of the technology.
Yes.
I will have to get those costs. I have some figures, but I can't say that those are confirmed figures. I will undertake to have those figures and have them released.
Thank you, sir. Zara Burton.
Good night, Prime Minister. If a businessman who gets a special exemption to come into the country, will that person be subject to geofencing? That's question one. And I would prefer, if I could, to get an answer before I ask the next question, because then it would be a follow-up.
So any person coming into the island would be subject to the orders. The orders specify two modalities by which a person could be quarantined under the order. One is in a state quarantine, the other is in a home quarantine. The decision is made on a public health basis, and there are many contemplations for public health, and the public health authorities can speak to that. There are also other considerations. Would that person be taking up a space, for example, that someone else could have occupied? These are considerations that we have to think of. But the geofencing would allow us to have to use more widely the modality of home quarantine, because it gives us a certain level of assurance that someone who has been released to home quarantine in their home, that they are actually staying within the confines of their home. So it doesn't matter if the person is a businessman, a wealthy person, or a poor person. Once we have general application of stay at home, everyone would be required to use the technology, whether it is a bracelet or tracking by phone.
Okay, second question. After the 2-week quarantine period, will the tracking information be destroyed? Who will have access to that information? How long will it be kept?
Yeah, very good question. The government agonized over using this capability. When we developed the app with this in mind. But because of the contentious issues of data protection and privacy, and we had not yet passed the Data Protection Act, which we've just opened the debate in Parliament, we were very reluctant in using it. But events have made it necessary that we contemplate that with the coming in of more than 1,000 Jamaicans at once. So the protocols around it is that the person's data would not be kept. The phone will, the term that they use, will be pinged. That means a signal will be sent to the phone, and then that signal will return the geolocation. So there is no tracking on a consistent or continuous basis of the person's telephone, but at regular intervals, that phone will be pinged. So there's not much information that will be stored. And even then, we are very reluctant because, there can be all kinds of mischief and machinations that will expose the government. So it's something that we are looking at, but we're very careful, indeed reluctant to do.
Thank you, Mr. Prime Minister. Let's then go now to Mrs. Jackson-Miller from RGR.
Oh boy.
Dion, go ahead, please.
All right, thank you so much. Now, a medical doctor has shared on social media his experience, I've spoken to him as well, with referring 3 patients who he said met all the Ministry of Health criteria for testing, but who were never followed up or tested. He also said he was tested, only got his results after nearly 2 weeks after making a lot of noise about it. So is it that the Ministry of Health does not test all the referrals from doctors? And could the 0 new cases being announced today, in fact, be as a result of inadequate follow-up and referrals? My second question has to do with the protocols for letting in the ship workers. Mr. Prime Minister, you've announced and explained the detailed protocols and especially the time in quarantine that will be required. Now, how does Jamaica then let in tourists and cruise passengers in particular in another perhaps month or so, given the concerns about false negatives from rapid diagnostic tests and the unlikeliness of your being able to make any tourists in hotels go into 14 days quarantine?
So remember I said earlier that the quarantine requirement depends on the public health assessment as to where we are in the epidemic. That is, I won't speak to the public health issues, but largely that is determined by an assessment of the reproductive rate of the virus in the population and whether or not there is a threat of a spike and other factors as well. Where we are now is that anyone coming into the island must go into 14 days quarantine in either a state or home-based quarantine to be determined by the public health officials. So at this point in time, there is no contemplation of, say, for example, tourists coming to the island. When we are in a position to reopen the island to not just tourists, but to persons coming in, then there will be a different set of protocols applicable in keeping with the constitution of the country. So I don't think you could speculate what the government is doing now versus what will happen in a few months' time. As I said, as always, we go by the public health science, we go in a measured way and in a situationally appropriate way. The situation now makes it appropriate for quarantine. As we improve, as the reproductive rate of the virus diminishes, as we see the new cases daily diminish or peter out, and we recognize that, yes, we are practicing the social distance, the hygiene, and these things have become second nature to us, then we can change the protocols that exist to facilitate even more opening of the economy, which would include tourism and general travel to and from the country.
The issue of referrals, sir, concerning
the Minister of Health or the CMO, I'll invite to answer that question.
Hi, good evening, everyone. Thanks for your question. There really is no valid reason why that should happen. We have been working to ensure that our general practitioners are able to refer in their cases and to ensure that the persons are tested. So I am hoping that that is something that will not recur. It's unfortunate that it did happen, but I would encourage the general practitioners to make contact with the medical officers of health. In most parishes, the medical officers of health are well familiar with the general practitioners and should be able to address their concerns. We also are using the app now for persons to be able to make the appointments themselves online. So I'm hoping that going forward, we will not be hearing of a recurrence of a problem like this.
Thank you, CMO. We have a few more questions on our Zoom from members of the media. I have one that has been recurring on social media, sir. A member of the public is querying, really, in light of the relaxation of some of the measures relating to churches, what are the arrangements for funerals? in terms of attendees?
I invite the Minister of Local Government to join us.
Thank you, Prime Minister. The protocol that has been established surrounding funerals and following a meeting we had some 3 weeks ago with the undertakers, there was an agreement that funerals would be allowed. They recommended 15 funerals per day at each cemeteries, including the major ones and the public cemeteries. They recommended 15 persons in attendance. It would be 10 mourners plus the reverend and the persons who would be doing the burial, and also the question of practicing the sanitary requirements at each location. So funerals are allowed using the guidelines that has been set out in the order, and those guidelines are working as we continue to work with the undertakers to ensure that it is maintained. Prime Minister, while I'm at the microphone, I'm just getting a number of messages. The opening hours of bars is from 11 a.m. tomorrow morning, closing 1 hour before the curfew hour begins. So that is 11 a.m. each day, closing 1 hour before the curfew hour commences.
Thank you so much, Minister. All right, Prime Minister, let's then go to Ms. Brittany Clark from Nationwide Radio.
Hello, good evening, everyone. Okay, my questions are, firstly, the writers of a one-page Observer editorial this morning slammed the Holness administration for, quote, fiddling while the economy is hurtling towards a crash, unquote, and that you've been indecisive about the reopening of the economy, in particular the tourism sector. What is your response to this, Mr. Prime Minister, and when do you plan to reopen the tourism sector? My next question, can you provide additional details on the resources that will be spent to house the additional Jamaican nationals being repatriated? And how far along are we with the training of additional healthcare workers to facilitate the process? Thank you.
Well, you know, the government can never be described as fiddling. The government can be described as being deliberate, as being considered, as being measured, as being very strategic in what it has done. And we are going to move with speed and alacrity to ensure that our economy does not crash. This is a concern that I have said at the outset, that we are balancing lives and livelihoods. We will, at some point, declare when it is feasible, when it is practical to reopen our borders for tourism inflows. We hope that this can be very soon. That is determined by how we keep the virus spread and transmission under control. That is determined by the public health advice that we get, and it is determined by how the sector itself indicates to us their own readiness for return to business. There's also the consideration of ensuring that we repatriate our Jamaicans who are overseas and wanting to come home very quickly. The consideration is, of course, that if for any reason the virus were to tomorrow or a week from now die down, the infection spread were to disappear, then most certainly, immediately, we would reopen our economy. That not being the case, we have to ensure that we keep the transmission at a very low level. Because, in a sense, it is, ironic, because if it is that we don't keep the virus and its transmission at a very low level, then our destination will not be seen as attractive. So all works together. So I think at this time, we must all work together. The tourism industry, the Ministry of Health, the Office of the Prime Minister, the man on the street, the vendor, all of us must work together to keep the transmission of the virus very low, maintain faithfully all the orders as it relates to the control of the disease. And that will bring forward the date that we can reopen the economy. What the public can see from this government is that at every opportunity, the first chance we get, as we see that we are bringing the virus under control, we release the restrictions to allow the economy to grow and have a resurgence and move towards its full capacity. So the tourism interests can rest assured that we are working very hard to ensure the economy will return to full capacity.
Training and resources, sir?
The Minister of Health could answer those questions regarding the training of health workers. And the cost for housing,
Yes, sir, the additional cost.
Those costs are currently being assessed. But you could essentially extrapolate from costs that have gone before. Minister of Health.
Thank you, Prime Minister. Some of these questions are difficult to answer off the top of your head. So I had to get a briefing from the Permanent Secretary. I'm told that we have spent about 80 million. It's going to cost 81.2, so we haven't actually spent that amount as yet. Million, of course, 81.2 million. So that's the estimate, but likely to be more depending on the time. It's quite an expensive venture, which is why all answers should come with a little bit of explanation. We have to move into the home quarantine arrangement, and the Cabinet is now actively considering that and the mechanisms that have to be put in place. Because as we live with COVID, institutional arrangements are going to become less frequent, even though still necessary in some cases. I'm sure the country will understand why we had to do it in the early stages, because control was very important in order to manage the risks associated with the spread of COVID. In terms of training, that's an ongoing process. I don't have any cost related to training, Prime Minister, but part of the new dispensation, which we'll comment on in more details later on, is engaging more human resource capacity. I'm sure you'd have heard me say that part of the challenge we face is that we're using the existing capacity of public health, the public health nurses, the public health inspectors, the community health aides, to do the contact tracing, to do a lot of the work on the ground. And frankly speaking, we are extremely stretched to our limit. Fortunately, the Cabinet has given approval for additional capacity to be engaged, and we are now actively in the process of recruiting, which will also be supported by training and then deployment. And so over the next month or two, we should add a fair amount of capacity to the numbers that we currently have, which will make managing the process a lot easier. Thank you.
Thank you, Minister. Minister, we have had some indications, Prime Minister, that there are some follow-ups. I would only urge members of the media if they could be as succinct and brief as possible in questioning so we can get through as many. Let's go to the lone gentleman on the call this evening, Damien Mitchell from the Gleaner.
Thank you, Naomi. Dr. Tufton, you had announced on April 27 that you would be releasing in a day or two a report on the circumstances surrounding the death of first-time mom Jody Ann Ferron. What's the new timeline to make that report public? That's question one. Question two, how much more money have you received from the government since your permanent secretary's last report that you needed additional funds for the COVID response? Question three, will there be any further announcement, and this is for the Education Minister, in respect of the school system, with parents now expected to go back to work on June 1 and their children required to stay at home for online and distant learning? And there's also one question coming in, Mr. Samuda, if you could oblige. This is from a teacher who is asking whether there will be any consideration for 5th and 6th form students to go back to school before the July exams to maximize their chances of getting good grades.
All right, so I think I had responded on the initial releasing of the report when I indicated that because it became a police matter, we did not, or certainly the ministry did not want to prejudice the investigations that were taking place. We have met with the investigating officers. They did come and visit me at the ministry's head office, and I know they have been to the respective hospitals, university, Spanish Town, and so on, and we are awaiting the conclusion of that process. I mean, clearly we have announced some other measures, like reviewing the standards in private hospitals, and we have commented publicly on that. But as it relates to the specifics of this particular matter, we took the position that since the police was involved, we would deal with them and allow them to do the investigations. On the issue of budgetary allocation, as you know, the Minister of Finance spoke, was it last week, on the new arrangements, the adjusted budget. This week there will be further discussions around that, and so I will await the conclusion of that exercise, at which point it will be public knowledge as to the specifics of allocations, adjustments made for the COVID response.
Thank you.
Minister Samuda.
Now, first of all, as I mentioned, we will be in about the second week of June. The students who are going to be writing CXC will be returning to school, and we will set up the distance, social distance, so that there's no threat to the COVID spread. So that is those kids, children who are going to write the exam, CXC. As for the other children, they're going off on holiday. They're going off on summer school. And it is our hope that we'll be able to get them into school before the official September opening of the primary care and the secondary care system. And during the course of the summer, we'll review it and see to what extent we can lend support through all the agencies, the whole family care system of the Ministry of Education will try to assist the children who now will be at school, but the parents will go out to work and so on. So things will actually return, hopefully, to the normal state that existed prior to COVID. But we know that it is going to impact on the way we live in the future. So we will, in the ministry, do everything in our power to try to see to it that the children are not put at a disadvantage, and also that every assistance is given to the parents who have to take care of those children.
Sorry, just to be clear, and with further to what Minister Samuda said, the lifting of the work from home orders will be accompanied, as I had said and Minister Tufton has said, with protocols which will cover the considerations such as children who would have to be cared for at home. We are entering into a new paradigm for the workplace, which we will now have to rely more heavily on the flexi-work legislation. We have now gotten a taste that it is actually possible to be effective in utilizing virtual meetings and virtual spaces. So we have to incorporate all of this. So with the help of the private sector and other experts, we will come up with a comprehensive set of protocols that would facilitate those parents who would have to have their children at home while school is out.
Thank you, Prime Minister. It's 7:44. We're aiming to wrap up by 7:50. Let's go to Vanessa Silvera from the GIS.
Good evening. My question is, as the government moves to reopen the economy, how much thought has been given to the possibility of a new wave of COVID-19 cases? Are we prepared? Also, I'm not sure if you can give some idea of what those protocols will look like, because as you can imagine, that's following up on Damien's question, because as you can imagine, families would have gotten into this new normal and parents are assisting students, their children, but no, they're going back to work. That raises questions of protection, not just about them continuing schooling, but who is going to supervise them and so.
Right, so I go back to my original answer that the protocols will establish that. But you asked a question, which I think it's a good way to end the press conference today. The COVID-19 epidemic will end at some point. How will it end? It could end if there is widespread immunity in the population. That's one way. It could end if we were able to get a vaccine, which would be a controlled way of introducing immunity into the population. It could also end if the infection prevention and control methods, if the stay at home, work from home, if you are vulnerable, if you're over 65, if all the other measures that we have put in place, if they are faithfully followed, it will lead to a reduction in transmission of the disease. And eventually, the disease will be within our population, around us, but we will have learned how to live with it. So another way of ending the epidemic is to learning how to live with it. So yes, as we reopen, spikes could occur. Those spikes could occur if we do not keep faith with the measures that are in place. That is the crux of everything that we're doing. If we do not keep faith with the measures, you will have a spike. If we keep faith with the measures, make them second nature, we will conquer this disease. Which leads to a point. In my assessment of what is happening, this is now not with any data, but just my anecdotal assessment, which we will have to go more deeply using data. I would say that most Jamaicans are following the protocols established in the orders. I would say that most Jamaicans are wearing masks, though not always, and not always properly. I would say that most Jamaicans are observing the curfew orders, though not always, but a high level of compliance there. Social distance seems to be the most challenging order. I've observed the lines, and there is an issue in terms of our culture and having to line up, because there's always a fear that whatever you're lining up for will run out and you won't get. But we have to overcome that in living with COVID. There is always a challenge with the physical distance. You sit here and then you sit over there. There is I would say, however, a high compliance with if you are ill, stay at home. From what I'm picking up, most persons, once they feel any form of flu-like or respiratory-like illness, they're opting to stay at home. So there's a higher level of consciousness. Once these measures that we have been speaking to the public about, once they become part of our nature, we will overcome this epidemic. And I think this is the point that I would want to end on. The reintroduction of populations into Jamaica coming from overseas, they too will have to follow the orders, because not every jurisdiction would have the same level of public education or faithfulness to the orders. So when they come back into the Jamaican jurisdiction, they too must be very vigilant in following the orders and protocols that have been established here. Once that happens, then we would have minimized the risk of a spike. So as it is right now, I believe we have minimized the risk of a spike with the local population. With the population coming in, we will have to engage in a very intense program of public education in two ways. One, with the population coming in, about the orders and protocols that we have established, and with the population that was with us from the start of the epidemic, about stigma. Because what is happening is that there has been so much fear and panic that this is now turning into stigma and possible victimization. So we will have to engage in a new round as we seek to repatriate many of our Jamaicans coming in, to ensure that the local population is aware and embracive, and that the population that is coming in is also aware and respectful of the orders and protocols that are in place. Once we get that correct, the spike that could happen would be largely mitigated. Thank you, ladies and gentlemen. Thank you, Jamaica, for listening.
Thank you so much, Mr. Prime Minister. Time being 7:51, we'd like to thank members of the media as well. For those who had follow-up questions, we apologize. It is now 7:50 and we are wrapping. Thank you, everyone, for joining us, and join us again for the next press conference with the Prime Minister in very short order. Have a good night, everybody.